Over the years, I've had the opportunity to wear many hats and meet lots of people along the way. I've always been inspired by their unique stories. I'm Terry Bradshaw. Join me as we meet the people, view the places, and experience the values and ideas that define our world today, right here on Profiles. According to the National Kidney Foundation, 26 million Americans have kidney disease. Approximately 350,000 of them are on dialysis.
Dialysis is a form of renal replacement. When the kidney function becomes so poor that it threatens health and well-being, it may be necessary for the patient to have a kidney transplant or go on dialysis. Dialysis performs the critical functions of the kidney and also sustains life.
Harrisburg Hospital was one of the first providers of renal dialysis and is now part of the Pinnacle Health System. Pinnacle Health System performs approximately 3,500 hemodialysis treatments per year. Advancements in technologies can improve a patient's quality and care. Such is the case with a blood loss detection device that is used in conjunction with hemodialysis.
Hemodialysis is a form of dialysis that uses blood. The blood comes through a special tube from the patient's body, goes through a dialyzer or an artificial kidney that filters out waste and fluid, and then is returned back to the patient through another tube. While this is important for kidney failure treatment, accidental bleeding is a concern.
Although most hemodialysis treatments are conducted under the supervision of a medical staff, the venous needle can still become dislodged and the blood loss may not be detected immediately.
A serious complication of dialysis is venous needle dislodgement, which can result in unnecessary death and liability for the provider. An average-sized female can lose more than 40% of her blood supply in less than 5 minutes if it's not detected early.
She says that the hemodialysis equipment used today is not equipped to detect venous needle dislodgement reliably. In 2004, after witnessing venous needle dislodgement on a number of occasions, the hemodialysis department of the Swedish County Hospital of Halmstad recognized the need for a blood loss detection device. They contacted a medical innovation specialist to develop a monitoring device that could be used during hemodialysis. Instead of trying to measure what was going on inside the dialysis equipment, the new device was designed to keep an eye on the access site monitoring for the first sign of blood loss.
Redsense is a blood detecting device using fiber optic technology. It consists of two parts, one alarm unit and one sensor patch. The alarm unit sends an infrared light through the optical fiber. When blood comes in contact with the optical fiber band at the tip of the sensor, it will trigger a visual and audible alarm.
Cleveland Clinic has been providing dialysis care to patients for nearly 60 years.
At the Cleveland Clinic, after experiencing a number of undetected venous needle dislodgements, in February 2010 they initiated a quality improvement project, including the Redsense device. Based on the results, they eliminated all undetected VNDs, and the Renal Physician Association selected the Cleveland Clinic to receive the 2012 ESRD Patient Safety Improvement Award.
After analyzing a number of serious bleeding episodes occurring over 8 years at the Veteran Affairs hospitals, the National Center of Patient Safety issued a safety alert in November of 2010. The alert mandates the use of Redsense for their risk patients as an additional measure for early detection of blood loss due to venous needle dislodgement.
News of the technology brings hope to hemodialysis patients like Rich Berkowitz.
I've been on dialysis for 9 years, in which time I've had 3 venous needle dislodgements, one of which was fairly serious. It's time that we finally have innovative products which take care of this very important issue that dialysis patients face on a daily basis. They need additional safety.